Hey everyone, I am really excited to be teaming up with the great folks over at Zealios for Ginger Awareness Month. I've been asked to speak a little bit about what I do as a dermatology PA and some of the ways that we can all, including gingers, make better decisions about sun protection. So I want to make it clear that I love the sun. We know that nothing on our planet could live without it, but it is very important to have a healthy respect for the role that it plays, both in sun damage and also its role in causing skin cancer. So if you think back to science class, we were taught about something called the electromagnetic spectrum. We know that a very small portion of the electromagnetic spectrum is what we consider visible light. It's basically light that is reflected that we perceive as color. But the majority of what is on the electromagnetic spectrum is actually invisible light, and that includes ultraviolet, which is the UV light that we talk about. Now there's three main types. There's UVA, UVB, and UVC light. UVC light really doesn't reach the Earth's surface. It's mostly absorbed by the ozone layer, but UVA and UVB both do. So both UVA and UVB radiation can cause skin cancer. UVA rays have a longer wavelength, which is why they penetrate the skin surface a little bit deeper. And although they're technically less intense than UVB, they account for nearly 95% of UV radiation. UVA rays can penetrate clouds and glass, which is why you can get sunburned on a cloudy day and sitting near a window. And their intensity is actually pretty consistent throughout the daylight hours. UV rays are also known as the tanning rays, which is why most tanning beds do use UVA radiation. Now, a tan is actually a result of damage to skin cell DNA. The skin actually darkens as a way to try to protect the cell structures from the sun. According to the Skin Cancer Foundation, tanning beds actually emit up to 12 times as much UVA radiation as the sun does. So it's no surprise that people who have used tanning beds are at a much greater risk for skin cancer. Now, UVB rays, on the other hand, do not penetrate the skin quite as deeply as UVA, which is why they are mostly responsible for sunburn and skin reddening. UVB rays are going to be strongest during the hours of 10 a.m. to 4 p.m., which is why it's generally recommended to avoid outdoor activities during those peak hours. We also know that up to 80% of UVB radiation can be reflected off of surfaces like water and snow, and is also going to be much greater at higher altitude. So what are some of the things that you should check for on your skin for things that could potentially be skin cancer? Well, first of all, any new spot that arises on your skin that does not seem to match the rest of what you make is always something that should be reason for closer inspection. Dark lesions that are new or growing are especially concerning because they could be early signs of melanoma, which is, of course, the most dangerous form of skin cancer. The ABCDs of melanoma include asymmetry, border irregularity, color difference, especially if there's multiple colors within the lesion or the mole, a large diameter, and especially something that is evolving or changing. Melanoma can occur anywhere on the skin, regardless of sun exposure, and can spread throughout the body if it's not caught early. So when detected early, melanoma is almost always treatable, so it's definitely something that you want to take seriously. Now, occurring more frequently than melanoma are actually basal cell carcinoma and squamous cell carcinoma. These skin cancers happen on areas of sun exposure, and so they're going to be a lot more prevalent than melanomas. They tend to be rather slow growing, but the treatment gets a lot worse and the prognosis gets a lot worse the bigger these cancers get. So these ones typically will resemble reddish or pinkish lesions. They might be pearly, they might be scabby, they might bleed easily. But the biggest thing about these is that they just don't seem to go away in the amount of time frame that you would expect. So the biggest take home with this is that if there's any spot on your body that just does not seem right, then definitely seek out the advice of a dermatology provider. I always tell my patients that I would much rather have them come in and find out that it's benign than to wait on something that is malignant. Things are always going to be better when they're caught early.